Despite a long border including China and a populace about 97 million people, Vietnam has recorded only simply a top 300 instances on COVID-19 about its ground or no longer an individual death. Nearly a month has passed in view that its final community transmission or the U.S.A. is meanwhile starting in accordance with Start-up. Experts address up to expectation not like sordid nations at present for as much infections and deaths of a massive scale. Vietnam saw a little eyelet hold to action express regarding and backed that fully. But though cost-effective, its intrusive and labor-intensive method has its drawbacks, yet experts' utterance it may additionally remain also late for just other countries according to examine from its success. Extreme however sensible measures when you're dealing along its sorts concerning unfamiliar early potentially hazardous pathogens, it's higher in conformity with overreact, says Dr. Todd Pollack regarding Harvard's Partnership for Health Advancement into Vietnam between Hanoi. Recognizing as its scientific regulation would soon grow to be swollen through even mild range of the virus, Vietnam alternatively selected opposition early, and on a massive scale. By quickly January, before it had someone confirmed cases, Vietnam's governance was initiating drastic action according to put together because of that secret modern pneumonia who had at that point wounded 2 human beings between Wuhan. When the preceding evil action was validated regarding the 23rd of January, a body whichever had traveled from Wuhan according to go to his baby within Ho Chi Minh City, Vietnam's fortune plan was among action. It very quickly acted in methods as appeared in imitation of stay pretty severe at the period however had been in consequence shown in accordance with be as a substitute sensible, says Professor Guy Thwaites, Master of Oxford University Clinical Research Unit OUCRU, among Ho Chi Minh City, as works together with the government about its infectious sickness programs. Vietnam enacted measures vile nations would receive months in accordance with movement on, bringing into journey restrictions, carefully limit yet sooner or later conclusion the border together with China yet increasing fitness assessments at borders and lousy inclined places. Schools had been closed because the Lunar New Year vacation at the quit concerning January or remained close until mid-May. A sizable then labor-intensive council building function bought underneath way. This is a U.S.A. up to expectation has dealt with a tussock over outbreaks of the past, says Professor Thwaites, beyond SARS between 2003 after avian influenza between 2010 or tremendous outbreaks of measles or dengue. The governance then population of very, altogether aged in accordance with Act including infectious diseases then are respectful about them, in all likelihood a ways extra and than wealthier countries. They be aware of what according to reply in conformity with these things. By mid-March, Vietnam was sending every person who entered the United States of America, or all people inside the U.S.A. who'd had consultation including a proven law, in accordance with quarantine centers because 14 days. Costs have been mostly covered by the government, even though inure was now not necessarily luxurious. One lady whichever flew home beside Australia, thinking about Vietnam a safer location in accordance with Remain, told BBC News Vietnamese to that amount of their preceding night they had only one mat, no pillows, no blankets, and some fan for the hot room. Protection against the asymptomatic. Professor Thwaites says quarantine of certain a large strip is authorization as much proof mounts so namely deep namely half concerning all infected human beings are asymptomatic. Everyone between quarantine was tested, ailing then not, yet that says it is evident up to expectation 40% on Vietnam's verified cases would have had no thought those had the evil had those not been tested. If ye have that level of asymptomatic carriers, the solely aspect you can slave in conformity with control it is such as Vietnam did, that says. Unless ye have been locking these people above that would simply remain wandering around spreading the infection. This additionally helps give an explanation for the non-appearance on somebody deaths. As near of the laggard Vietnamese had been students, tourists or commercial enterprise travelers, she tended in conformity with stay youthful yet healthier. They had a better jeopardy on battle the demonic themselves, and were not ever in a position in accordance with put, for example, aged family at risk, as meant the medical system could center of attention its assets over the not much quintessential cases. While Vietnam not ever had a aggregation countrywide lockdown, such swoop between concerning rising clusters. In February afterwards a pour on cases among Sun Loi, boreal about Hanoi, more than 10,000 people living between the surrounding location had been sealed off. The same would show up in accordance with 11,000 humans between the Ha Loi commune near the capital, then in accordance with the rod yet sufferers of a hospital. No one would keep allowed in and out till couple weeks had exceeded including no demonstrated cases.